This is a last lecture of epidemiology. The last point, that is control measures and the laboratory analysis of typhoid. The typhoid is caused by Salmonella typhi, and laboratory analysis and control measures are most important part in epidemiology. The samples collected for the analysis are called as isolates. Submission of Salmonella isolates to the National Microbiology Reference Laboratory is required by law. It means that the a patient which is carrier or infected by typhi, Salmonella typhi, carries these bacteria, and when they are collected for testing, after testing that material is submitted to this lab NMRL. If it is not completed carefully, then the recovery of bacteria is not possible. Hence, guidelines for specimen handling for this organism are important for recovery of bacteria. The specimen transportation is also most important for the results of testing. The transport time should be as short as possible for accurate results. To process the specimens quickly, that processing should be within a minimum time. The specimens incubated at 37 degrees centigrade temperature, and in tropical countries specimen can be left at the room temperature. These specimens include various body fluids or tissue cultures. For the culture, small sample of your blood, stool, urine or bone marrow is placed on a special medium that encourages the growth of bacteria. The culture is checked under microscope for the presence of typhoid bacteria. A bone marrow culture often is most sensitive test for Salmonella typhi. Although performing a cultural test is most common diagnostic test, other testing may be used to confirm suspected typhoid fever infection, such as test to detect antibodies to typhoid bacteria in your blood, or test that checks for typhoid DNA in your blood. In this way, the samples are utilized for detecting the presence of bacteria. The first, that is blood. Blood culture is mainstay for a diagnosis of typhoid fever. It is said testing the bone marrow is more reliable method for diagnosing typhoid and is avoided being a painful procedure. The bone marrow is not suitable to patient, but blood test is easy and it is used in practice. 10 to 15 ml blood from the children's and adults, school going children's, is taken for detection or analysis. 2 to 4 ml from preschool children, that is 1 to 5 years old children, and it is used for the testing. Transportation of this sample is at ambient temperature, that is below 15 degrees centigrade. The serum, 1 to 3 ml blood inoculated into tube without anticoagulant, due to which it gets coagulated. After clotting or coagulation, serum should be separated and stored at 4 degrees centigrade. This sample should be frozen at below 20 degrees centigrade if longer time storage is required. That is, it should be tested as quickly as possible, and if it is not possible at that time, it is stored at frozen condition. Then next sample is stool sample. It is for acutely ill patients. In sterile wide mouthed plastic container, stool sample is collected. It should be processed within 2 hours after collection. If it is not possible, then it should be stored at 4 degrees centigrade. These samples are tested. That methods, out of that one is Vidal blood test. The Vidal blood test works as follows. An individual's blood sample is contaminated with bacterial recognition sites, that is antigens. If mixture forms clumps, then the individual's blood contain antibodies that specifically recognize the sites on bacteria. The antibodies are bodily defense proteins present in blood. They are very specific for their targets or antigens. Large amount of antibodies specific to the same antigen indicates that the individual has been exposed to that specific antigen. Consequently, if blood sample clumps upon exposure to Salmonella enterica antigen, then that individual's blood contain a bacterium specific antibodies, which indicates that he or she has been exposed to bacterium. Whereas the detailed wild test can tell the titers of specific antibodies. The Vidal test is losing its value as it is a labor intensive and time consuming. Next test is Typhoid test. This test is a medical test consisting of a dot ELISA kit that detects IgM and IgG antibodies against the outer membrane protein of Salmonella typhi. The Typhoid test becomes positive when within a 2 to 3 days of infection and separately identifies the IgM and IgG antibodies. The test is based on the presence of specific IgM and IgG antibodies to specific 50 kD OMP antigen, which is impregnated on a nitrocellulose strips. IgM shows recent infection, whereas IgG signifies remote infection. The most important limitation of this test is that it is not qualitative and results only positive or negative. It is a immunochromatographic test. Each analysis, Typhoid test or Vidal test, has its own limitations as well as advances. Next test is Tubex test. Tubex is a 5-minute semi-quantitative and colorimetric test for typhoid fever, a widely endemic disease. Tubex test contains 2 types of particles. One is brown magnetic particles coated with antigen. Second one, blue indicator particles coated with 09 antibody. During the test, antibodies get attached to brown particles and settle down in a test tube, and the blue indicator particles remains on upside. It indicates the positivity of test, means a presence of typhoid bacteria is indicated by this blue color. Other treatments are also there during the infection. Drinking the fluids along with the therapy, along with the medicines, this help prevent the dehydration that results from the prolonged fever and diarrhea. If you are severely dehydrated, you may need to receive fluids through a vein. That is, intravenous input is necessary for the protection of that individual. If infection is very serious, then surgery is suggested. If your intestine become torn, you will need surgery to repair the hole. In this way, medicines and the laboratory analysis is available for curing the patient. But before infection, control measures as well as prevention of this disease is most important. Typhoid fever is a common in places in poor sanitation and lack of safe drinking water. Access to safe water and adequate sanitation, hygiene among the food handlers, and typhoid vaccination all are the effective in preventing the typhoid fever. Means all these cleanliness activities along with food handlers as well as drinking water sanitization also there is helpful for prevention. All the travelers to endemic areas are at potential risk of typhoid fever. Although the risk is generally low in tourist and business centers where standards of accommodation, sanitization and food hygiene are high. But in our country or in the growing nations, this is not possible for each and every uh, center, business center or the living places. Hence, typhoid infection is common. The control measures also include another factor, that is vaccines. Two types of vaccines have been used for many years to protect people from the typhoid fever. One is VICPS. It is an injectable vaccine based on the purified antigen for people aged over the 2 years. Another vaccine is TY21A. It is a attenuated oral vaccine in capsule. This capsule formulation for a people aged over 5 years. These vaccines do not provide long-lasting immunity and are not approved for children younger than the 2 years. But they are helpful in prevention of typhoid up to some extent. The new typhoid conjugate vaccine with a longer lasting immunity was pre-qualified by World Health Organization in December 2017 for use in children from the age of 6 months, and it is showing its best results for prevention. Along with these vaccines, medicines and treatment, the education is most important. Education to community members. The members present in community means all the members. Total population should be educated we see one by one. Education to food handlers. Food handlers, that is the people which are present in food handling process. They are present in hotels, hostels, in food malls, daycare centers, residential homes for elderly, orphanages, prisons, etc. These people should be educated for the hygienic conditions, cleanliness, etc. Along with that, food makers, which are the people which are involved in food processing industries, food cooking in all level, right from the household to larger one. They should be educated about the typhoid endemic, typhoid disease, etc. The food eaters means all the remaining people, they should be well known about the control measures of typhoid, cleanliness and hygienic conditions about the typhoid. Food servers, the serving members in all above mentioned list: hotel, hostel, food malls, residential homes, etc. Means each and every member of our community, each and every member of our population should be educated about the all conditions which are essential for prevention of typhoid. Educate for avoiding the infection and how it is possible. Basically, the receiving typhoid vaccine. Each and every child get vaccine. Then there is control of typhoid is possible up to some extent. Then wash your hands frequently by soap and hot water. It is essential for avoiding the direct entry of bacteria from the hands into your digestive system. And these bacteria which are concerned with a contaminated water and contamination of water by fecal matter. For that purpose, the good sanitization condition is also most important. Then next is avoid drinking untreated water. Only bottled water is used for drinking purpose during the journey, because as well as in household conditions, water should be clean and should be non-contaminated, because typhoid is spread, this bacteria is spread through water and fecal contamination. Avoid raw fruits, unpeeled fruits, vegetables, undercooked food, street food, street drinks, the flavored ice and fruit juices, etc. Means the food which is available on a road in a under hygienic or the unhygienic conditions is not suitable for the eating. Choose the hot foods before infection. When it is a hot or a steaming, at that time that food is free from such a bacteria and other infections also. And all these activities are helpful, that is good sanitization and cleanliness is sufficient. Medicines are not only sufficient, but along with that, this education is also essential. for the control of typhoid fever.